I think 3, 4 years ago, if you had asked me what was the biggest concern around information and education on 340B, I would tell you that nobody knew anything about it. Even when I first started working on this program, really in earnest about 6 years ago, people didn't even realize there was anybody other than the hospitals. Go back and read the big press stories, Politico, Washington Post. They didn't even mention that there were grantees. Now, and even up until a few years ago, people didn't know what was going on in 340B. Now, I'm discovering that we are fighting a much more serious adversary when it comes to education than a lack of information. We're fighting misinformation. Okay. There is not a day that goes by that I don't have somebody who I would think or hope would know better say something to me as a fact that they truly believe is a fact because they have heard it from people who present themselves as being factual. So the biggest threat nowadays is what people think they know about 340B that is incorrect. So far this week, I have heard that covered entities are pushing to have more covered entities added to the program. I have heard that Congress can't do anything about 340B. It all has to be left up to the courts. I have heard that PBMs, it is their responsibility to ensure transparency in this program. And I have also heard that health centers don't care nearly as much about 340B as they do about their funding cliff, even though we know that the data says the opposite. Those are quote unquote facts that I have heard from people and from very well-positioned policymakers. Not all of those this week, but I have heard those sorts of statements from well-positioned policymakers. Just last week, we learned that there is a national op-ed campaign rolling out, and this is the direct quote from one of the pieces. It was in California. 340B exploits communities of color. And people called me and said, well, how can that possibly be? And I said, because I think people are feeding op-eds to people who don't know any better. That one was published by a minister. Another one's published by a council member, by an accountant. They're just publishing whatever they are told. And these lies are taking on truth. I just heard today that the National Black Caucus of State Legislatures is coming out against any sort of state 340B bill, a bill to protect 340B. Every day we open up the news and there is another attack on 340B, and I would say at least half of them are based on what I would consider to be misinformation. That is the biggest threat I think we are facing in 340B right now. I cannot promise anybody that a national PR campaign to try to write the record about what 340B is going to solve all of our problems. But what I will absolutely bet my house on is that if we do not do something big and loud to push back on the misinformation, we are going to lose. That is a guaranteed loss. So I have worked with the CV340B people on many other issues. They carry through, they do what they say they're going to do. They are mission-driven people. And we need to move quickly. They have an infrastructure in place. So that's why I'm very happy that they are moving on this, because it's, if anything, it's well overdue and we need to move quickly. And so I would welcome any grantee who wants to participate in this. This needs to reflect the grantee voice and the grantee reality, as well as the hospital reality.